In focus this evening, the mind and modern medicine. While not a substitute for traditional treatments, things like laughter and happiness do help the healing process. Here's NBC's Kenley Jones.
Being aware of your breathing in and being aware of your breathing out.
Casey Cloninger has had a lung transplant. His body is racked with pain. But instead of using more drugs to relieve it, he's undergoing what's called healing touch therapy, taking his mind off his pain by concentrating on the feeling in other parts of his body.
It definitely helps the pain. It lowers the pain without having to use any type of medicine, which is not good on your body.
Using the mind and spirit to bolster the therapeutic value of traditional medicine is the subject of a conference this weekend sponsored by Duke University Medical Center.
We have focused on science and technology. It's brought miraculous cures, but as we think more about it and we listen to others, we realize there's more to that. Science alone is not enough.
Deep breath all the way down to your stomach.
For example, experts say science has limited value in controlling stress in patients. They must play an active role by making a conscious decision to overcome it.
Let your body settle in on this table.
To help them do that, some hospitals like Duke, which provided this video of a patient undergoing heart catheterization, are using anodyne imagery. Anodyne means without pain, a technique that uses communication skills, breathing exercises, and relaxation to help reduce anxiety about painful medical procedures.
It can make the high-tech environment much more patient-friendly.
Researchers are exploring the relationship between spirituality and medicine as well. A Duke study found that older people benefited both mentally and physically from attending religious services.
Some of the research is now actually showing that people who are more religiously involved live longer, have lower blood pressure, lower rates of heart attack from coronary artery disease.
And then there's the healing power of humor, which many doctors and nurses swear by. On Duke's cancer ward, Ruth Hamilton makes her rounds with the Laugh-Mobile, delivering funny books and tapes and silly toys for sight gags. Scissors for the doctor, perhaps?
When he starts complaining about this and that, would you say, can you cut it out now? Cut it out.
What's important to remember, conference officials say, is that the techniques being discussed here are not alternatives to traditional medicine, a reliance on herbs or home remedies, for example. They are measures that complement scientific medical practice. Doctors here predict these techniques will become a part of normal medical procedure in the very near future. Already, many of the nation's medical schools are beginning to teach young doctors that the mind and spirit, as well as the body, are important elements of medical practice. Kenley Jones, NBC News, Durham, North Carolina.